What are the risks of radiosurgery for AVMs?
So there were several factors that a patient needs to consider when looking at radiosurgery for their AVM. The first factor is what we call the latent period, or the time period between treatment and AVM obliteration. And what this is we know that radiation delivered to an AVM does not make the AVM shrivel up and go away immediately. The radiation takes several years to cause the blood vessels of the AVM to thicken and occlude. And typically this is at least 2 years, possibly 3 or 4 years. And during this period of time, there's a small chance that the AVM can hemorrhage. So we know that there's an annual bleed rate of AVMs. It's thought to be approximately 2 to 4% per year. So let's say we take the mean of that at 3% a year. That means every year the patient has a 3% chance of bleeding from the AVM. And if it takes several years for the radiation to work, the patient still may have a hemorrhage while we're waiting for the radiation to kick in. Another risk factor of radiosurgery for AVM is that the radiation can cause some edema or swelling in the brain around the AVM. And the reason for this is as follows. The radiation achieves its results of obliterating the AVM by generating an inflammatory response. The inflammation causes the AVM blood vessels to thicken and obliterate. However, the same inflammation may cause some edema or swelling in the brain, in the normal brain tissue right around the AVM, because the inflammation generated by the radiation is not necessarily specific to the AVM blood vessels, meaning that if there's brain nearby, the brain may develop some of this edema. The edema is generally temporary, but can take several months to run its course. And the edema can cause symptoms such as headaches or seizures until it resolves.
If you like this video, don't forget to subscribe.